Okay, so we're going to pick up here with part 4. Now, I want to make one brief comment about part 3 that we just finished and that you watched right before this. I was talking about your extrinsic tongue muscles. You have styloglossus, hyoglossus, genioglossus, and palatoglossus. Styloglossus, genioglossus, and hyoglossus are all innervated by your hypoglossal nerve, so cranial nerve 12. And I mistakenly said that palatoglossus was innervated by cranial nerve 9, your glossopharyngeal. That's not correct. It's actually cranial nerve 10. Okay, so I misspoke. Palatoglossus is innervated by cranial nerve 10, and the other 3 are innervated by your hypoglossal nerve, which is cranial nerve 12. So with that, we'll get started on spinal nerves now. So you have your cranial nerves, and now we have our spinal nerves. So we had 12 pair of cranial nerves, 24 total. Now we have 31 pair of spinal nerves, or 62 total. We can name them based on where they emerge from the spinal cord. So if they're emerging from the cervical region, it's a cervical spinal nerve. If it's emerging from the thoracic region, it's a thoracic spinal nerve. Or if it's emerging from the lumbar region, it's a lumbar spinal nerve. You can even go further into the sacrum and coccyx as well. To see these different spinal nerves emerging off the spinal cord. So you can see these here. We have one thing to note about the number of vertebrae. So if you count the number of vertebrae, which are here to the right where my cursor is, these vertebral bodies, and then you count the number specifically for cervical. So count the 7 cervical vertebrae, and then count the cervical spinal nerves, and you'll note that there is one more nerve than there is vertebrae. But for all the other ones, there's exactly the same number. Okay, so for the thoracic, you can see T1 through T12 spinal nerve, and then T1 through T12 vertebral body. For lumbar, you see L1 through L5, L1 through L5, S1 through S5, S1 through S5. So why does cervical have one additional spinal nerve than it does the number of vertebrae? Well, the reason is that the first cervical spinal nerve actually emerges from atop or on above the first cervical vertebrae. So you can see the C1 spinal nerve is actually coming out on top, and so for all your cervical spinal nerves, they're actually going to be coming out on top of what they're named. So C1 spinal nerve is on top of C1 vertebrae. C5 spinal nerve is on top of C5 vertebrae. C8 is actually on top of T1 because you don't have an 8th cervical vertebrae. And then from here, for our thoracic, lumbar, and sacral, the named nerve is coming out underneath the named vertebrae. So T1 nerve under T1 vertebrae, T8 nerve under T8 vertebrae, L4 under L4 vertebrae there. Okay. Now, see, the spinal cord is actually going to end, if you have watched our the peripheral nervous system lecture, which I guess we're doing the peripheral nervous system lecture right now. I think we talked about it maybe with the central nervous system lecture. And we talked about the spinal cord. We said that it ends around T12 L1 level. And so it's going to end there. And then you have spinal nerves continue inferiorly, known as the cauda equina. And so these vertebrae continue down, but the spinal cord doesn't. So some of these nerves have to travel down and then exit through a transverse, through between these different vertebrae here. So you can see these different regions: cervical, thoracic, lumbar, and sacral, and we'll take a look at some of these in a little bit closer detail, as well as a cross-section of the spinal cord. So when we're looking at our nerve, the spinal nerve is really a combination of a couple things: a dorsal root and a ventral root. Sometimes dorsal is referred to as posterior root, ventral is referred to as anterior root. If you recall, dorsal root is purely sensory. It's containing purely sensory fibers going into the spinal cord, and the cell bodies of those sensory neurons are located in the dorsal root ganglion, a ganglion being a collection of cell bodies outside the central nervous system. And then we have our ventral root. And our ventral root is containing purely motor neurons that are leaving the spinal cord and going out to our periphery. Now, that's the spinal nerve, what it's made of: dorsal root, ventral root. As soon as you form your spinal nerve, you immediately give off 2 main branches. These are called rami, and you have a dorsal rami and you have a ventral rami. Dorsal rami is going to the back, so ramus means branch. It's a branch going toward the back, so parts of your posterior trunk, muscles back there, skin. And then you have a ventral rami, or anterior ramus or branch, going toward the anterior aspect of our trunk, as well as our upper limbs. Okay? And then we have little things called rami communicantes, and these are communicating branches is what this means. Rami branch, communicantes is referring to communication. So these are communicating branches that we associate only with the autonomic nervous system, and we'll look specifically at the T1 to L2 spinal cord level is where we'll see these rami communicantes. So here you can see our spinal cord. As a review, you have your gray matter in the middle, you have your white matter around the outside organized into columns. You have the dorsal root ganglion with sensory cell bodies. You have your dorsal horn of gray matter. You have a ventral or anterior horn of gray matter that contains your cell bodies of motor neurons, and then you would also have a lateral horn of gray matter, but that's only going to be found in the T1 to L2 region, and we know this is a cervical vertebrae because you can see a bifid spinous process. You see transverse or vertebral foramen, so you know that this cannot be part of the thoracic or lumbar region, so you're not going to see a lateral horn of gray matter. But note that we will have it eventually. So you can see these branches as soon as we form our spinal nerve. We have a dorsal rami going toward the dorsal aspect, and we have a ventral ramus coming out to the anterior aspect, and we see the same thing here. You see dorsal root ganglion, dorsal root, ventral root, our gray matter. They form a spinal nerve, and we're giving off a dorsal branch and a ventral branch or a rami. And here we can see this thing known as a white ramus and a gray ramus. These are our rami communicantes, and we'll look more at these with the autonomic nervous system lecture, and how fibers will travel through these, through a white ramus and synapse, or ascend and descend in something known as your sympathetic chain, and then it will exit out through your gray ramus and then go to wherever it needs to go to provide sympathetic innervation. But we'll get to that with the autonomic nervous system. So here you see the same thing. You see your dorsal root, ventral root, dorsal ramus, ventral ramus. So note, root and ramus are different. This is a root, this is a root, this is a dorsal ramus, this is a ventral ramus. So they're different, okay? And then you can see your white and gray ramus, those rami communicantes associated with the sympathetic ganglia or our sympathetic chain that we'll see. And here now we can see our lateral horn of gray matter, which is containing the cell bodies of our sympathetic neurons as they come out. So you can see it comes out, enters the ventral root, spinal nerve, white ramus, synapses, it leads to the gray ramus, and then it can go to the dorsal root or ventral root, depending on if it's traveling to a structure in the front of the body, anterior aspect, or in the back, or the posterior aspect there, or the dorsum. So we have different nerve plexuses that exist within our body, emerging off our spinal cord at different regions. And most of your nerve plexuses are containing the ventral rami of your spinal nerve. So this, if you're looking here, it's this ventral ramus coming off the anterior aspect of our spinal nerve. And we have four main plexuses: cervical, brachial, lumbar, and sacral. Sometimes the lumbar and sacral are combined, and you'll see it referred to in textbooks as the lumbosacral plexus. So they kind of merge these two together and look at it as one whole collection of nerves. So we'll look at our cervical plexus first. It is going to contain cervical spinal nerves, obviously, since it's a cervical plexus. And one main nerve loop is known as the ansa cervicalis, and it's containing upper cervical nerves that form this kind of loop-like structure that get a lot of the muscles in your neck. And then you have one main nerve known as the phrenic nerve, and the phrenic nerve innervates our diaphragm. And there's an easy mnemonic to remember what spinal cord level innervates or results in the formation of our phrenic nerve and what it does. So you have C3, 4, and 5 keeps the diaphragm alive. So that's the little mnemonic. So C3, 4, and 5 keeps the diaphragm alive. And so it will travel down. You can see it right here. C3, 4, and 5. All these branches here coming down and it will get our diaphragm. And then this loop right here, this is the ansa cervicalis. You don't have to worry about this as much. Just know that it exists here from C1 to C3. It lies over the top of a lot of muscles and structures within our neck and will provide lots of motor innervation to the muscles in that region. Okay, and again, this is called the ansa cervicalis. This is your phrenic nerve. Okay, all right. Our brachial plexus. Our brachial plexus, brachium, if you recall from anatomical terminology, is the arm. And so or specifically the upper arm, but we're going to refer to the brachial plexus as getting the entire arm in terms of its motor and cutaneous innervation. Now, the brachial plexus is a very complex nerve structure. You don't have to be able to name every single thing going on with the brachial plexus, but it terminates in 5 branches, okay? And so I want you to know these 5 branches and a general idea of what they do. So you have musculocutaneous, axillary, radial, median, and ulnar. Some of these stay in the upper arm. Some will continue all the way down into your lower arm and all the way into your hand. So your musculocutaneous is going to get your anterior arm compartment. Arm, I mean, when I say arm anatomically, the arm is everything between the elbow and the shoulder, essentially. That's the arm. Everything between the elbow or the antecubital region and the wrist, that is forearm. And then you have your wrist, and everything distal to your wrist is your hand. Okay? So in your anterior arm compartment, you have the musculocutaneous nerve that gets your biceps and your brachialis muscle, which cause flexion of the arm at the elbow. You have your axillary nerve, which gets your deltoid, along with some of your back muscles, which like your teres minor. You have radial nerve, which gets your posterior arm muscles as well as your posterior forearm muscles. So a lot of your extensors. You have the median nerve, which is going to get your anterior compartment forearm muscles, so your flexors. And then you have the ulnar nerve, which is getting a lot of your intrinsic hand muscles that move the actual muscles that are located within the hand itself. Okay, so you have muscles that reside in the forearm or the antebrachium that actually move the hand, but then you have intrinsic hand muscles that are embedded within the hand itself. And a lot of those are by ulnar nerve. Some of those are also by median nerve as well. And your ulnar nerve, I have here funny bone. This is your funny bone whenever you hit it. So if you stick your arm out, left or right, and you feel on the medial aspect kind of near your elbow, there's a large bump. Not your elbow, but kind of more medial and anterior. There's this large bump, which is known as the medial epicondyle of the humerus. Just behind that is the nerve, which is your ulnar nerve, which is your funny bone. So you can irritate it just yourself if you put your hand right or your finger right behind your medial epicondyle and kind of move it around. You may hit that nerve, hit that ulnar nerve, and you'll feel it radiating down your forearm and down into your hand. Okay, so that's what it is. Whenever you hit it, it's not very funny, but it's called funny bone because it's associated with your humerus, and so it's humorous. It's funny, but in all reality, we all know it's not really funny. So here's our brachial plexus here to the right. So you have different divisions here that are in gray, orange, blue, and green. So these are called roots, trunks, divisions, and branches. Sorry, I forgot cords. You have roots, trunks. You have roots, divisions. Let's see. I'm trying to say this here. So you have roots, trunks, cords, divisions, and branches going out from the spinal cord. Sorry, I couldn't get that out. There's a mnemonic, if you remember it. The mnemonic is Randy Travis drinks cold beer. So roots, trunks, divisions, cords, and branches going out. You don't have to worry about all these roots, trunks, cords, divisions. Just focus on these 5 terminal branches here. So musculocutaneous, axillary, median, radial, and ulnar nerve here. And then a general description of what they do here. You can see the same thing over on this side. Our brachial plexus is formed from C5 to T1, so C5, 6, 7, 8, and our T1 spinal cord levels all contribute to the brachial plexus. All right, our lumbar plexus. This is getting a lot of nerves in our lower limb, and there's three main ones. It's going to be the genitofemoral nerve, obturator nerve, and femoral nerve, getting lots of things in our leg. So here you can see a genitofemoral nerve getting parts of our genitals as well as skin and the medial aspect of the thigh. You have a femoral nerve, which is going to get a lot of your anterior compartment leg muscles, so like a lot of your quads. And then you have an obturator nerve, which is getting some of your medial compartment thigh muscles, so a lot of your adductors there. We have the sacral plexus traveling down toward the limb, and you have a couple of nerves. One major one known as the sciatic nerve you've probably heard of. You may have heard of it in relation to sciatica. If somebody has irritation of that nerve, it can cause some discomfort. The sciatic nerve is a large nerve. It's from the S2, 3, and 4 spinal cord levels, and it has a couple of parts. So within the spinal cord itself, it has a tibial and a common fibular division, and then the common fibular will branch into a deep and superficial fibular. So the tibial division gets a lot of muscles in our posterior leg compartment. The common fibular, anytime you see the word common, you know it's going to branch into something else, and it branches into the superficial and deep. The deep gets your anterior leg muscles, so the muscles down in the part of the leg below the knee that cause dorsiflexion, and then your superficial fibular nerve gets a lot of the muscles in the lateral leg compartment that are off to the lateral aspect there. So you also have your gluteal nerves here. These are going to get, there's a superior and an inferior. They're named superior and inferior according to where they travel in relation to a specific muscle. That muscle is called the piriformis muscle, but you don't have to worry about that. And these are going to get a lot of our gluteal muscles, so gluteus maximus, gluteus medius, gluteus minimus. So here we can see our sciatic nerve. You can notice that it has a tibial and a common fibular division here, and then it will branch further down from your common fibular nerve into a deep and superficial fibular nerve. You can also see a superior and an inferior gluteal, which are going to get your gluteal muscles a little more superior to what this image is showing. So we're going to stop right there, and we'll pick up with just the last few slides in part 5.